Okay, so we're going to talk a little bit about trauma's impact on brain development and how that influences treatment and how that influences even how we address the concerns. So we think about program offerings, community involvement, all of those pieces, right? It should be built on what we know influences brain development when we think of intervening. Okay. The first concept that I want to address is that neurons change, right? This is a key component. I want you to think about some of Perry's work in the early 2000s and how it looks at the human brain is rapidly developing during this early time in life, right? The brain is changing in response to experiences. So it's expanding, it's learning, it's taking data in, and it's dependent on its experience and exposure. Okay, so what do I mean by that? The parts of the brain that you use most often get stronger. Now, that's really important considering the impact of trauma. What gets used a lot when trauma is on scene? The limbic system, our fear center, the emotional encoding from the amygdala. So neurons that fire together wire together. So if we are constantly in the early stages of development, what is end up happening is we're having this exposure to fear and this exposure to threats and this exposure to this insecurity in the brain, feeling like this place is not safe. That's what's getting used a lot. What is not getting used? The cortex, the upstairs part of the brain, our cortex, our frontal cortex, our prefrontal cortex that kind of, pulls all those components together. That is not getting used. Now, why is this important? Think about early childhood. What are they developing, right? Their brain is trying to develop executive functioning, problem solving, attachment, that creativity, awareness of themselves in the world, trying to develop their sense of identity. All of that is found in the cortex, frontal, and prefrontal cortex. Therefore, these things are not getting activated. So we don't have the opportunity then for some of the neurons to change and grow because we're not using those parts of the brain often. So what gets used more changes more and adapts and learns how to get stronger and bigger. So I want you to think about the impact that this has on what does that mean for treatment, for intervention and addressing it.